Well, today is World AIDS Day, an international day dedicated to raising awareness of the virus. And joining us live now this morning to discuss some of her advocacy work is the ambassador for the Canadian Foundation for AIDS Research, Muluba Habanyama. Thank you so much for joining us.
Thank you for having me.
Oh, we appreciate it. And for you, just to give people a little bit more of your background, you have lived with HIV your entire life.
Yes.
Tell me how that experience, a little bit of background on that, but how that shaped your drive to become an ambassador and to do this advocacy work.
So me growing up with the virus and learning about it from a young age, I really just thought it was something normal, like many kids would have different types of diseases. Then I realized the stigma that was attached. My parents were both like, it's a shameful disease, it's a secret, you can't tell anybody. I watched my mother tell somebody from church. The next day the whole congregation knew. So many situations that as a child I started to feel isolated, started to realize I was different. I can't say that there was a changing moment because I wasn't diagnosed at a point, but I knew that I was different. And it was, yeah, a really scary realization. My dad died when I was 14. My mom died when I was 19. And really at the age of 21, I really decided that I don't want HIV to beat me. You know, HIV doesn't control me, I control my HIV. And that really just inspired my activism. And it just kind of really came naturally. It wasn't something that was planned. And then it just flowed, and now we're here.
And you decided to battle that stigma. That's what the work that you do is in part trying to raise awareness, get people involved, but also just let people know that things are different. We need to know that the stigma is not there. Unfortunately, it still is. You still see it.
I would say that's the one thing that hasn't changed. Sometimes it has actually gotten worse. As a child, I would take like 6 pills twice a day. I hated it. I would be pumped with Onshore. I had a feeding tube. And now I'm down to, 3 pills once a day. There's some people that take 1 pill once a day. There's an injectable that you take bi-monthly to control. So we've had many scientific advancements. We now have a prevention pill, but then the stigma is still there. People are very uneducated. I'm 30 now, and it's hard to disclose to somebody I'm dating, even disclose to a friend. I see that isolation, and unfortunately, I do think stigma is the reason why HIV is still rampant, and we're having new testing in Canada. I mean, we've actually risen in the test, and it's 2023. I mean, people should not be testing positive for HIV. We have a control. This was something that was thought as a death sentence, and now we're at this point because that's stigma attached to it, and that also trails into a lot of intersectionality. I'm a Black woman living with HIV, so I get a lot of racism, sexism, and HIV stigma all at once. And for me, why I want to do my advocacy is, first of all, to tell people that there's many different faces of HIV. You never know somebody's story, and to hopefully decrease stigma.
And you brought up a good point about so many people. The stigma is even preventing some people from going ahead, getting the treatment. Some people are going undiagnosed. Many people, we mentioned it today, and trying to raise that awareness so that that stigma can disappear and people can get the help that they need. What about some positives that you're seeing? I know that the last time City News spoke with you, you were at an eatery event, HIV and eatery event. What was that like? Because it was such a unique event and something that I think really got the message across.
I think so. Something like the eatery, I was disappointed at first because 70% of Canadians said they would not have food prepared by a person living with HIV, which was also like, girl, how do you know, okay? And now, after the whole COVID thing, HIV is not something to be worried about. But then after having the event, first of all, having a room of followers and supporters, I do wish my parents were alive to see that not everybody is scary and not everybody is judgmental, because I do have many supporters and many people that that follow me and are just so gracious of what I do. And so that's something that really inspired me. The Public Health Agency of Canada is trying to endorse U=U, which means if somebody has an undetectable viral load and takes their medication, they cannot sexually transmit the virus. And so seeing those little wins is definitely makes me happy. And we have a lot more work to do, but I truly do believe we can do it.
Other than stigma, is there another big challenge that the community is facing that you think can be tackled?
Yes, absolutely. So I think one, we're in a country that doesn't have universal drug coverage. Sometimes I'll go to the States, or I was in Amsterdam, people are like, oh, Canada, free healthcare. And I was like, it doesn't work that way. I'm from Ontario. And so I think universal drug coverage, because how can we tell people to test and they may not necessarily get health insurance? You know, I had difficulty when I graduated college and got a job where my medications were very expensive, my insurance wouldn't cover it, and so it almost seems like you're debilitating that and bringing me back. I also think HIV criminalization of a non-disclosure. We need to make this a public health issue and not make it a legal issue, so that really stops people from getting tested, from getting the care. And we need to make sure all communities know about this. You know, I think there's a lot of homophobia, a lot of racism to where we think it's a black disease or a gay disease, and that's absolutely not true. And we absolutely have to educate people that it happens in so many ways. And I hope that people can really learn from it and really do one step of education today on World AIDS Day.
All right, Muluba, thank you so much for joining us. We really appreciate your time.
Thank you for having me.
No problem.